At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Early Onset Dementia and Alzheimer's on Wednesday, December 17th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM WMAL.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Welcome, everybody. This is Ageless Health with Dr. Tom Roselle, and we've got a great program for you. An amazing look at why we don't grab a hold of our mental capacity early enough so we stop ourselves from going into that dementia and potentially Alzheimer's. Is that real deal? Unfortunately, we're seeing more and more of it on an ongoing basis, and we're going to dedicate the program to the warning signs, if you will, and it leads into a program coming up on the 17th, coming up very, very shortly, kind of this coming Wednesday night, on dementia leading to Alzheimer's. And we want to give you as much data as we possibly can because we don't want this to befall you. You're going to be surprised how many things we ignore, how many things that we put aside. But the exposures and the damage that is done very early on. But what is it that you have to be aware of? So we're going to cover that a little bit today. But by the end of the program, I'm going to give you a little clue on something that if you have gentle symptoms of I'm losing my mind, there might be a way of fixing that. But we'll talk about that towards the end of the program. So don't go away. Make sure you listen all the way through, and we'll give you that data. So let's get into it a little bit. Let's talk about what these signs and symptoms might be, and leading to memory loss, and what happens when you have difficulty completing familiar tasks, changes in your mood and personality. My wife will tell you that my mood changes on a day-to-day basis. I'm schizophrenic as hell, but having said that, that's just me being my crazy self, and I'm usually not like that. She kind of exaggerates, I think. Anyway, the key warning signs of dementia and Alzheimer's are not just memory loss, but there are other things. You can't complete things that you started. But here's the deal. So if you have memory loss, one of the most common early signs of forgetting things, it leads to, kind of not being able to put information together, even dates and events. How about, you did something a week ago and you can't remember that it was a week ago? That's quite significant, but there's subtle changes like that. But if you ask people to repeat the same question over and over again, and you say, well, I just didn't hear you. Sometimes that's not just a loss of hearing, although loss of hearing can lead to not having good memory patterns. So they can go hand in hand, but we have to be careful to be able to distinguish between the two of them. So be real careful with those things. Go get a hearing test. If your hearing's still in pretty good shape, not necessarily perfect, but you're still asking people to repeat things, it's because you're cognitively not processing. And now we start relying on memory aids. We're starting to write things down instead of our brain being very sharp and to the point. That's a sign, and we have to be careful with that. I want you to be aware that there are certain things that you need to not set aside. There are certain things that, if you put them behind you instead of in front of you, you got a problem. So let's get on with that a little bit. So how about, do you notice that now as the time has gone on that you can't problem solve like you used to, that you have difficulty following a plan, you have trouble even following step-by-step directions or recipes, or even managing your monthly bills, not at very large levels, but just subtly. You're not in the sync that you used to be. You're not as detailed as you used to be. You're not as follow through as you used to be. those are signs, and they start very slowly. They start very, very specifically in tasks that are familiar to you. So when we talk about completing familiar tasks, just like we alluded to right now, it's day-to-day stuff, things at home, at work, even your leisure activities. You start dropping them off, and you're not aware of them as you used to be aware of. Like, oh yeah, I used to go for a walk every day. Oh yeah, I used to, go to this place and look at art and so forth. And all of a sudden, you don't have an interest in it anymore. The loss of interest and the unwillingness on your part to re-grab, retrain, reprovoke an interest, if you will, can be one of the challenging signs of your mind not working the way it's supposed to. How about this time of the season? You want to go out and enjoy all the happiness and the lightness of the season, the love that we see, or maybe sometimes just this time of the year, and you just sit there and say, no, it's too much effort. Is it too much effort? Is that motivation? Is that a motivating situation? And guess what? That may be as a result of a depletion of a whole host of what's called neurotransmitters that sit in your intestinal tract. The neurotransmitters are made by your microbiome. That's your good bacteria in your intestinal tract. And if that's gone, your get up and go just got up and left. It's not working the way it's supposed to, but you begin to think it's just your age and you forget things and, it just don't have the motivation. But that's all part of common warning signs and signals that may lead you to cognitive decline that's much more significant than what you got going right now. The point of it is you can stop it. There are tests that can be done that will tell you in detail. They're called neurotransmitter tests. It's not a blood test, it's a urine test. And guess what? With our patients, we send them home with a kit. We have them do the test kit, and then we couple that with a brain span test, which is just a kind of a finger prick test. And then you do another piece of it on a computer. And we can put together these specific pathways that are not working the way they're supposed to. Now, here it comes, is you and the doc trying to decide where all this nonsense started. You've heard me say many times, and I think we talked about it a little bit on the last program, that PTSD is one of those things that can cause not only emotional problems, but also mental, cognitive problems as well, relative to confusion and poor judgment controls. Depends where it got hit. If you got hit in the middle of the front of your head, just above your eyes, and got a really good blow there, your judgment, your frontal lobe, your executive decision making abilities kind of goes down the tubes. So you start doing and making poor choices financially. You start making poor choices relative to how you take care of yourself. You don't dress the way you should dress. You don't look as good as you used to look. You're saying it's a bad hair day, so you put your hair underneath your hat instead of taking the time and provoking the look that you want. Those are indicators that things are not moving and working the way they're supposed to work. So how about if you're confused with losing track of dates and even the time of year, the seasons? How many of us would get older and say, time's passing so fast, and I can't believe it's Christmas already? Is it that it's not Christmas, or is it something else? I don't know about you, but if I start forgetting holidays and that enjoying the moment from Thanksgiving to Christmas, or from the middle of the summer, the 4th of July to Thanksgiving, and it seems like they're all blended, it's time to take a deep breath of air, my friends, and back off a little bit and see what is really provoking that. It's not just necessarily getting older. It's allowing our body to break down and degrade and thinking that it's just what happens to everybody as we get older. Not true. Trust me, there are people out there who have more capacity to push forward and be able to maintain their ongoing interest in life. And they continue to do. They may shift. Maybe they're not quite as strong as they used to be, but they shift and they still have the ability to have interest. And that's one of the pieces that begins. If you start losing interest, if you start getting confused, if you have difficulty completing tasks, if you have challenges solving minor problems, you got a problem. That's called a signal. That's a sign. And if you let it go, you will go into what we lovingly call old age dementia. You'll lovingly go into that end stage, perhaps, into Alzheimer's. So, what can we do to make sure that we don't get sucked in that hole? Number one, realize and admit to yourself that some of these things are happening, and then go to somebody like me or somebody that does good functional medicine testing and knows how to look at it from an injury platform, biochemical insult, and that emotional stress and strain pattern, because all of those things will cause you problems as time goes on. But let's talk about that decreased or poor judgment, that executive decision-making problem that kind of got set aside. You start making bad choices. You spend money that you don't have. Your credit cards are on overkill. You were never like that. You never did that in the past. Could those indicate a progression towards dementia? The short answer is this is very possible, but you have to look through the whole puzzle. We talked about the neurotransmitters. It's a urine test and it's a saliva test. It's not even a blood test. You don't have to deal with that. But the neurotransmitters will show you whether or not you're going into a state of confusion. In young kids and adults, we call that ADD or ADHD, attention deficit disorder, hyperactivity disorder. And if those things are beginning to brew and they were never there before, there's a reason for it. We talked about the brain remembering injury, but wouldn't it be great to find out if that's really true for you? What happens when you want to avoid getting involved with anybody? You just don't care. You used to be the social butterfly, and now you want to stay away from people. You don't even want to talk to them. You think they're all dumb and stupid. You want to fight with them instead of, really sitting there and having an adult conversation with somebody. That's an indicator. That's a sign that you may be starting to slip a little bit. Not a good thing. So if you find yourself, particularly in today's world, we have a lot of pressures and stresses around us, and nobody agrees with anybody else. But your own family, do you really want to get into a fight-flight reaction with them? Or do you want to say, listen, I understand that we have differing opinions, but let me give you some of the reasons, but give them objective stuff. And if you can't give somebody objective reasoning for why you feel the way you feel or why you think the way you think, then it could be one of two things. You either just want to fight and it's an emotional knee-jerk reaction, or you really haven't taken the time to filter it through. And the same goes for them. If they have the want to just get in your face and say, I don't want to talk to you anymore because you don't think like I think, the question becomes, well, why don't you? What's the reason? Convince me, show me. And then your ability to be willing to accept that information. We all get into combat way too quickly when it comes to arguments. But guess what happens? It causes us to shift and change, and unfortunately, sometimes irretrievably. I don't know about you, but I continue to want to find out what the real reasons are, and I challenge all my thought processes on an ongoing basis. So when you have these types of things, what's the best time, if you will, to begin to explore the possibility in that you may be slipping, not being able to walk through a process anymore, that you forget where you are, and occasionally you walk into a room, and it's not because you're stressed and distracted, but you forgot why you walked in the room, and there's really nothing else that's drawing you aside. That's, I would say to you, is a really good time, and to say, hey, I think I need some help, before it gets to the place where you become argumentative and you can become combative and you start forgetting other things. The hygiene thing with people is a giveaway. Pick somebody that always used to be meticulous, and all of a sudden you see them now as they're getting older. They really don't care what they have on. They wear the same clothes. They forget to put certain pieces of clothing on. Those are real telltale signs. And sometimes it goes so subtly, they don't get it, or say, when's the last time you had a shower? That odor that you can pick up of dry, dead skin that shouldn't be there. And this person was somebody who was really, really on point all the time. They don't even take a wet washcloth now and wash their body down. That's called, better pay attention. Something's not going to. So, if it's somebody that you love, Have a gentle conversation. Say, hey, listen, not for anything. Are you, is why aren't you doing X, Y, and Z anymore? You used to do it all the time. Don't you enjoy it? Or is it just too much trouble? Or you don't think it's necessary? All of those things can be potentially, if you will, potentially an indicator of a rapid, slippery slope going down a pike of, oh my God, now what I do? So I have to make sure that you understand that these subtle changes can accumulate and stack rapidly over a long period of time. What are the things that you have to be aware of? What are the things that, if you're still cognitive and solid, that you can't deny are there? Do you look at somebody that you know and love, and for a second you can't come up with their name? That's called a symptom. It's your granddaughter, it's your niece, it's your best friend that you grew up with. And you get in a conversation and you have a cogent back and forth, and all of a sudden you forget what it is that you were talking about, and you can't connect the dots. You're still speaking in a conversational mode, but you don't remember why you said what you said. What was the point that I was trying to make? And that never happened to you before. That's called stop and pay attention. Don't let it build. Find someone other than someone's going to give you a drug of how to fix this thing. Next week, coming up on the 17th, that's next week. On the 17th, Dr. Scott Lamp and I are going to go through this. We're going to talk about a brain span test. We're going to talk about neurotransmitter testing. We're going to talk about the things that are very specific relative to what may be going on. These are the important pieces that you can't ignore. Have you noticed that, you can't sleep the way you're supposed to sleep? You used to sleep through the night, not a problem. And I'm not talking about just getting up and going to the bathroom in the middle of the night, and that's often hormonal, and that has to be taken into consideration as well, because if hormones are not balanced properly, you're going to lose your thought process, but you're not going to be able to sleep through the night. You're not going to be able to repair. One perpetuates the other. These neurotransmitters that I keep touching on are significant, and they can be blocked from going from one receptor site in the brain to another by something that you've heard me talk about before called glycation. What is glycation, you ask? Well, glycation is when something hardens and forms a barrier, and not just an inflammatory barrier, but a barrier abrupt. So if you take a cup of sugar, put it in a saucepan under the lowest heat possible, and you slowly stir, what happens to it? It caramelizes, right? That's called glycation. Now, that same thing happens in your brain. Your brain needs sugar, but it doesn't need so much sugar that it's going to form a glycated pattern because your body heat and cause a sticky barrier to stop neurological transmission. So if that's the case, can it be reversed? Yes. It's also what we call type 3 diabetes. Dementia, Alzheimer's has been given a loving term over the years, and it's called type 3 diabetes because it seems to be involved in the inability of the body to process blood sugar into the brain. Could it have to do with insulin? Perhaps. Or could it just be an overabundance that your body can't do anything with and it has to store it? When we look at motivating patterns, we want to do type of thing. So there's a whole linkage that's involved some different types of neurotransmitters like dopamine and serotonin and the like. So if we can understand the deficiencies and we know what motivates them to begin with, we can begin to change things. Listen, if you didn't do anything more than get your butt up and go for a walk every day. Remember, I used to say and continue to say 2 miles every day? Just 2 miles. If you walk 2 miles as slow as you want, say, oh, it's cold outside. Well, put a hat on, a stocking hat, put some gloves on, and get your butt outside. And by the way, put a scarf around your neck. And if you walk, you're going to get all that toxin to move instead of accumulating. You're going to get some fresh air other than the stagnant stuff that you got in your house. You're going to get your muscles to fire. You're going to upregulate something called ATP. What does that mean? That's called adenosine triphosphate. What's that about? That's the energy fuel, if you will, that different cells, and particularly mitochondria in your body need to have to be able to function optimally. Where's mitochondria? In your brain and also in your heart, the two most concentrated areas. Every muscle tissue has it, but the brain and the heart are two of the most demanding, if you will, of anything that's available in that ATP synapses. So what it does is it upregulates it. Now, so if those things are true, if it upregulates it, but we're going to be deficient on its availability, then we got another problem. And we're going to talk about that in just a few moments towards the end of the program. I promise you I'll tell you what it was. So what body functions begin to get depleted? If we get to the place where we're not breathing normally or we stop breathing, it's like, well, why aren't you breathing? You go, oh, I forgot. You hold your breath in and you don't let it out. It can be the beginning stages of your body's non-recognition of its normal automatic functions. That's way down the line. We have to be real careful with that. We have to make sure that that's not part of the deal. So if we start seeing things misfiring, we start seeing fatigue patterns, loss of interest in things, we don't recognize where we are. Here's one that we have to be real careful of. Let's say that you're on the highway and you're going, if you're in the Washington metro area, you're on the Beltway and you're headed south. You take 95 and you're going to go down south toward Richmond. And all of a sudden you get distracted by something on the radio and you're coming up to your exit. And instead of turning on your exit, you just continue to go straight. That's called a sign and a symptom. That's called an indicator of something that's really going wrong. If that takes place for you, and it's happening on an ongoing, regular basis, that's the time that you better do something pretty quickly, because that's where communication from one neural synapse to another is not working the way it's supposed to. That's your ADD platform. That's your attention deficit disorder platform. You used to be totally focused. You could handle multiple things at one time, but now you can only handle one thing. You know that if you're traveling, you better turn the radio off or turn the music off because you're not going to pay attention to it. It's not okay. Those are a sign that you have to do something about it. So when we're talking about these neurotransmitters that are generally there to allow transmission from one neural receptor to the other, and they're either being competed with or they're being blunted by, you're going to have those kind of things take place. How about when you used to be able to really efficient, you get all kinds of things done very quickly, but now you walk into your room and it looks like a freaking disaster? Well, that can happen from time to time, but if it's ongoing, that tells you that you're not firing on all cylinders. So we have to look at these mechanisms, these neurotransmitters. We have to look at injury patterns. We have to look at, believe it or not, fluorides. How many of you have been exposed to fluorides by going to the dentist all the time? How many have been just drink regular water coming out of your faucet loaded with fluorides? Where's the impact? The brain, the heart. And it causes degradation, inflammatory reactions, and diseases to take place. Also, by the way, can predispose you to cancers. We covered a lot of information. I promised you that I would tell you about one substance that was very specific. It's called creatine. Creatine's always been used for muscle building and so forth, but guess what? The studies have shown that it'll help restore memory function. We're going to talk about that on the 17th. We're going to tell you what you can do with that. I've actually started taking a little bit of it. You know what? It works. It's unbelievable, but it does make a difference, particularly in subtle changes. But there's a lot of other things that you have to do with it as well. Covered a ton of stuff. I wish I could have 3 hours with you and break them all down into small, specific pieces. But we're coming up to that time where I have to say I'll see you next week. And join us on the 17th. Call 703-698-7117. And remember, I'm here every Sunday for one reason only. I love you all. Have a great day. Bye.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. If you are in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Call 703-319-6990 for a complimentary consultation or visit bestinsmile.com. That's 703-319-6990 or visit bestinsmile.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Early Onset Dementia and Alzheimer's on Wednesday, December 17th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.